So maybe we will start to get started. Thank you for coming, everyone, to today's BIAR educational talk. My name is Mary. I'm with the Brain Injury Association of York Region, but I'm mostly with the Brain Injury Society of Toronto, where I think I know some of you from. I am very eager today to introduce MQ, who is a therapist with NeuroCore Physiotherapy and Pilates Center, who will be speaking about the lymphatic system and the role of lymph work on clients with traumatic brain injury. I've never heard about this topic before, and maybe that's similar for all of you. So I'm very eager to hear this talk. Just so you know, MQ has given permission for this to be on YouTube for 3 months. So this is being recorded. And just a reminder, I think some of you heard my dogs in the background. If you are not talking, please be on mute because it reduces the noise level overall. And there will be time for questions after. If you want to put your question in the chat so you remember, you're welcome to do that. But otherwise, welcome, MQ.
Thank you so much, Mary. Hello, everyone. Thank you so much for having me. I would like to just start with a little bit of an intro just about how I got into the lymphatic work. Like what Mary was saying, that she hasn't heard a lot about the lymphatic system, and I don't think you're alone, Mary. I've been a physio for over 13 years, and for the first 8 years of my practice, I did not utilize any knowledge of the lymphatic system. About almost 6 years ago was the first time I was introduced to a course called manual lymphatic drainage. And that's when I first got in touch with what the lymphatic system was and what are things we can do to improve the health of the lymphatic system. In physio school, we only had one lecture on the lymphatic system, and it was about post-cancer care. I think a lot of us have heard about lymphedema after having cancer. Sometimes the lymph nodes are removed. So what happens is the lymph of the part where the lymph nodes are removed can become swollen. And lymphatic drainage is a very popular technique to improve the drainage of that body part. But that's almost as much I knew about the lymphatic system. I didn't have a grasp of what it looks like, how the role it plays in the overall health of our body. I came into the course because one of my best friends from high school, she had skin cancer, and she had lymph nodes removed in her legs. So she actually had to go to Italy once a year to get drainage done and specific procedure done. So I really took the course just with the mind of maybe I'll learn about the system, I can learn about the technique, and maybe she doesn't have to go to Italy every year. But after I realized she really just wanted to go to Italy once a year. But what I found after I take the course was the lymphatic drainage, it has great role in post-cancer care. But it also has a really, really important role in the overall wellness of people. So that's why I started practicing on almost every single client that I see. I think there's a role for it, and I'm really excited and passionate about sharing what I know about the system and what you can do starting today to help your own body take care of its own lymphatic system. So I'm okay with being interrupted. If you want to turn on your mic, if you have a question, I'm more than happy to stop and answer any questions you have along my presentation. And if you feel like you want to turn on the camera, I'm happy to see your face as well. Okay, so for today, the objective is I want you guys to have an understanding of what the lymphatic system is, what it does, and how can we improve the health of it. And I will have a specific focus on how it applies to the population of traumatic brain injury. So what is the lymphatic system? The picture on the left side is a very simplified illustration of what a lymphatic system looks like. It's by no means what it looks like in the body. It's much more complex than that. But what I found is sometimes when people think about it's a complex system, they stop understanding what it can do and what it looks like. It's a system that consists of a lot of vessels. The vessels are the trunks, the tubes. They're different than our blood vessel because it doesn't have a wall. Like you can see our blood vessels from dissection. Sometimes you can see the veins through the skin. For the lymph tubes, you don't really see it. They're just space in between the tissue. And that provides transport of the lymph, the liquid in our body. So without those lymph, we would just be skin, muscle, and bones, and we wouldn't have the plumpness in our body. There are little dots, the lymph nodes, which most of us know what they are. The lymph nodes are stations where drainage can happen, where they produce lymphocytes. These are the immune cells that fight against bacteria, fight against pathogens. So it's a system that's connecting the lymph nodes and the lymphatic vessels, and it collects the waste product from our body, and it puts everything back into our heart, our circulatory system, so it can be transported into our kidney and liver where the detoxification actually happens. So on the left side, you can see this. This is the illustration of where the lymph nodes generally are. We have about 500 to 700 lymph nodes in our body, and about 1/3 of it is in our head and neck. So you can see in the picture on the right. And you guys probably have felt when you get sick, you get swollen lymph nodes around, underneath here and here. Sometimes you can feel sore throat. That's also the tonsil. It's a lymphatic organ that gets swollen because it's trying to fight against bacteria. So our body puts a lot of lymph nodes in our head and neck because this is the area where pathogens come in, right? So we have to be ready to fight against these pathogens. So one of the big components of function of the lymphatic system is actually its ability to produce lymphocytes. So it protects us. The second part, which I will be focusing a lot on today, is its ability to transport things throughout our body, and mainly transport waste product throughout our body. So just some interesting fact about the lymphatic system. I've mentioned that it has a deep connection to your immune system. There are over 700 lymph nodes, and more than 1/3 are in the neck. There are actually 15 liters of lymph in the body. So we only have 5 liters of blood, give or take, and 15 liters. So there's a higher volume of fluids that exists in our lymphatic system. If you want to visualize what lymph actually looks like, it's when you get a blister. So you get a blister, and then that fluid underneath the skin, those are your lymph. Okay, but usually we don't see it. So that's why people can't understand what it does. We don't see it unless you get a blister and you drain it out, or you get a scar, and then that's like yellowish fluids, a little bit thickened than water. That's what the lymph is. It drains every part of our body. Specifically the brain, they actually did a measurement. They drains about 3 pounds of toxin. The toxin meaning the protein, the dead cells, it's 3 pounds. So I brought these. These are each 1.5 pounds. So imagine 3 pounds of toxin coming out of your brain every year. And if it's not working, what it can do to your brain health. The lymph vessels that actually connects our body, if you put it end to end on the straight line, it will circle around the earth 4 times. I don't know who measured it, but I believe it. So the picture I showed you earlier, it's a simplified version, right? There's actually a lot of little chunks that come out of it. So just imagine every single cell, every single tissue in our body have a connection to the lymphatic system. So it's a very extensive system, much more extensive than the circulatory system. It actually has a lot of connection to gut health because it helps with transport of fatty acid, protein, and nutrient transportation. So it's a really, really important system, but I really don't think we talk about it enough. I think recent years, the word detox has been really popular, but people don't use detox correctly with respect to the lymphatic system. So I just want to clear some of the things that the lymphatic system can do in its role in the detoxification. So that's what this talk is going to mainly focus on, not the immunity part, but more how we can get rid of the toxin of our body. So I'm going to use a lot of analogies to help you understand. The lymphatic system, we're going to think of it as a filtration system. So if we think about our body as an aquarium, okay, so this is my analogy. So if your body is an aquarium, the lymph is the water in the environment in the aquarium. The cells and organs in our body are like the fish that's in the aquarium. And your lymphatic system is that filtration system. So this is a fancy, on the right, it's a fancy aquarium. You can see in the bottom, there are pipes, right? They help you drain the waste product that the fish produce. You know, your fish pees and poos, just like every single cell of our body pees and poos. They produce waste, metabolic waste, right? It's not even toxin you ingest or exposed to, just normal everyday life. Cells die, they need to get rid of its waste product. So if you can think about an aquarium and its filtration system is broken or it's not working very well, the aquarium is going to get muggy, like the picture on the left, right? So imagine that aquarium being really dirty, the fish living in dirty water. That's what happens when your lymphatic system is not working very well. So when it's working well, nobody thinks about the lymphatic system. It just, it silences in that work. You don't feel its pulse. It's not like the blood, you can't see it, right? But when it's not working, your cells are basically just embedded in this dirty water, and it's not going to be healthy, right? So a healthy lymphatic system will give you a healthy tissue, but a not working lymphatic system, you basically are not able to get rid of the waste products. So the fish won't be healthy. Like imagine the fish living in that water. It doesn't matter if you give the fish the best food, or if the fish becomes sick, you give the fish medicine. The fish is not going to get better because it doesn't have a healthy environment. And it's the same thing in our body. If we don't have a healthy, clean lymphatic system that moves and circulates well, things may not heal very well, right? You can get chronic disease, you can get a condition, you can get sick, and you don't get better quickly because of that. So those are the two main functions of the lymphatic system. So I really today I want you to understand it protects us, and also it transports waste product. There's actually a lot more things. It just won't be the focus of our talk today.
Can I ask a question?
Yeah, of course.
Yeah, I put my hand up. I guess you wouldn't see if I had my hand up or not. Anyway, my question
is it Vidya?
Vidya.
Hi.
Hi. Yeah, I just wanted to ask. I know with concussion, I have been reading the lymphatic system. Is it different from the I don't know if I have the correct
Lymphatic?
pronunciation. Yeah, you know when they said that when you sleep, it cleans the brains or something. Is there a difference between the two, or is it the same?
So I'm actually going to talk about that in the later part of the presentation. So if you can hold on to that question, and I will be answering that.
Sounds good. Thank you.
It's a really, really good question. It's actually, I'm really glad you know about the lymphatic system. It's a different name, but it's the lymphatic system is a system that cleans the brain. They just give it a name called the lymphatic system. So anatomically, it's a little bit different than the lymphatic system, but and how we treat it is slightly different. But you're correct. That's why I want to do this presentation about how we can clean the brain. So how you can activate not just the lymphatic system, but also the lymphatic system.
Got you. Thank you.
We have to do the lymphatic system first, and then you understand why. Because if you don't clear this area, you can't clear your brain.
It's fascinating, you know, you never heard about it before concussion. After I had my concussion, I realized, there is such a thing happening. Before, you never heard about, like I never knew about it.
Yeah. Thank you for your question. Any other questions before I move on? Okay. So just some examples of what happens if your lymphatic system is not working. And by the way, I've been doing this for about almost 6 years, and I do lymph work to everyone I meet, or like I at least give an overview of it to everyone. Everyone has some lymphatic problem, and it's normal. It's just life. We don't have a perfectly healthy lymphatic system. So what, like if you notice you have these signs, usually generally these are cues that there might be some role for lymph work in your body. Most common one is swelling, edema, we call puffiness. You know, sometimes you wake up in the morning, your face is puffy because your face is not draining well. Sometimes people will be like, my ankle is always swollen. And I'll explain later. If your ankle is swollen, you can have a problem somewhere else in the body. It's usually not your ankle. You have pain. A lot of times pain is a lymphatic problem, especially if it's chronic pain. The pain has been there for a long time. You have a tissue that's just not healing well. If you don't get the waste out, you can't get the waste in. If you can't get the waste out, you can't get the nutrient in, right? So the tissue is not healing well. You get slow healing time. In terms of concussion, or even just general brain health, people will feel a fogginess of the brain, like the brain is not functioning very well because their brain is not clearing clearly. People can have digestive issues. A big part of our lymphatic system live in the digestion, right? So you can have indigestion, you can have constipation, you can have food allergies, and it can all be related to a not functioning lymphatic system. Weight gain is actually really interesting. It's our body has a mechanism to protect us against toxins. So if you have an area that has a lot of toxin, your body may actually put a lot of adipose tissue near that area. So to protect you from that overload of toxin. So sometimes people would just have weight gain because they have toxin that their body's not able to eliminate. And another very common thing is sometimes people will find that I just get sick all the time. Like any pathogen, I'll get sick. It's because your lymphatic system is so clogged up that it doesn't have enough function to protect you against the pathogens. These are just some common examples, but I honestly feel like any type of chronic disease have lymphatic work has a role in every chronic disease that we have. And there's actually a lot of research done on things like Alzheimer's, MS, LAS, and they have linked it to a malfunctioning lymphatic system in the brain. So that's the general understanding of the lymphatic system. Now I want you guys to understand, how does drainage happen? Like what happens? It can be complicated, but we're not going to go to the cellular level. I just want you to understand the direction of how drainage happens. It's actually really, really simple. If you just understand everything, that all the waste product eventually have to end up in our heart. Okay. So our heart is the one that collects all the lymph, and then that's going to send it to the liver, to the kidney, and excrete it through our body. So if I just give you an example, if I have waste product in my head, there needs to be pathway to go through my neck, go through my collarbone here, and behind my collarbone, there is a subclavian vein. That's the vein that's just right before you enter into the heart. The lymph had to go into here. So my head would drain into here. Okay. My hands, if I have something wrong with my hands, it had to go through my wrist, my elbow, my armpit, and it goes around on top of my collarbone. It enters my heart. Okay. If I have an issue with my breast, it just goes around, up, over, into my collarbone. They all end up here. Your abdomen, any digestive issues, any organ, they drain upwards through the thoracic trunk, over the collarbone, into the heart. Okay. Your hips goes through your abdomen, through your chest, through your collarbone, into your heart. Your pinky toe had to go through your ankle, through your knee, through your hip, through your abdomen, through your chest, through the collarbone, into the heart. You can't skip. You can't be like, I have like my left ankle is swollen. I'm going to transport that fluid into my right ankle and somehow it's going to go. It doesn't. It always have to find its pathway into the heart. And just like our traffic system, it has highways. So it has bigger trunks where things can move a lot faster, but it also has, locals, smaller trunks where things move slowly. So this is just a picture that just shows like we have areas where, remember I mentioned you have 700 lymph nodes, they kind of come in clusters. So the lymph nodes in each cluster, they're responsible for the drainage of that area. So for example, the armpit lymph nodes, they drain the breast, the outside part of the breast, the inside part of the breast goes to your chest bone, your groin drains around your hip and the lower part of your abdomen. This picture just gives you an understanding of the direction of where the fluid goes. But the order is always the same. They always have to go through into your heart. And now I want to give you an example. This is my other analogy. I love analogies. If you have a traffic jam in your lymphatic system, and depends on where that traffic jam is, you can have issues not just locally where the jam is, but somewhere far away, right? So for example, you live in downtown, you want to come to our clinic, which is in Highway 7 and 404, and you want to take 404. But there's actually a really, really bad accident just around Highway 7, and all the lanes are closed. So you start in downtown. If you get in there early enough, you can get on the highway and you're just going to get stuck there. Okay. But if you waited 2 hours, that accident is not being cleared, then the car is going to back up all the way downtown. And now you try to enter and you won't be able to enter. And then you just create this backlog downtown. Right. So what you could do is you can just take like kind of local and slowly go up. And that's exactly what has to happen in our body. We have a highway. The most important highway in our body from lower body to top body is through the middle here. This is the thoracic duct. This is our biggest lymph node in the body. It's called system chyli. The name doesn't matter, just a really big lymph node. And this is our biggest highway right behind the heart to collect fluids, to collect waste product from below the diaphragm up. Okay, so let's just say I'm blocked in here. Okay, when I'm blocked here, I may not notice any symptom right here, just right away. But if this is blocked long enough, I may get swelling down in my hips. I may get swelling down in my knees. I may get swelling down in my ankles, right? And you may not notice anything until one day you're like, oh, my ankle is swollen, right? Because you don't notice these things just move slower. So, and then if you come to me with a swollen ankle that came out of nowhere, which actually it's a true case that I saw, nothing happened, it's just ankle is swollen. And if I didn't assess your lymphatic system, I just thought, oh, you have a swollen ankle, let me move your ankle. Let me treat your ankle. I'll do all the best stuff to your ankle. Do you think your ankle will be better? No. It's just like if you're stuck downtown because like 404 is jammed up. And I just say, okay, I'm just going to shove you. I'm going to find a way to shove you into 404. That's not really going to be helpful for you because you're still not going to make it all your way to your destination, which is in your heart, right? So since I understand the lymphatic system and how the waste removal works, it actually changed my practice. I don't just look at one problem. If you come in with ankle pain or wrist pain or headache, I don't just go to where it is. I do a screen of your whole lymphatic system to see, is there blockage in the major highways? Is there something that we need to do to unblock before we can treat that area? So about right before I took the course, the lymphatic drainage course, I had this lady that she came in to see me. Her left ankle was so swollen, and she said, I don't know what happened. It just over the last 6 months, it started becoming really, really swollen. I don't remember rolling it. It doesn't really hurt, just really stiff because it's so swollen. And at the time, I didn't understand the lymphatic system. I assessed her ankle. All the range was okay. I said, okay, let's just maybe try some strengthening. Let's try mobilization. So we did everything. I think the swelling came down very, very little bit, but it wasn't getting better. So I told her, I said, I'm actually taking the course. Maybe after the course, I'll try to treat you. Right now, clear with your doctor to see if there's anything wrong, anything else that could be contributing. And after I took the course, it clicked that, like, I just remember seeing her body, remember her health history. She was telling me that she always had digestive issues. And then I assessed her lymphatic system, and I found there's just a lot of block around her abdomen area. So I actually did lymphatic drainage for her collarbone first, for her neck, for her chest, and I did it for her abdomen. I didn't even touch her leg. I think 2-3 treatments later, her ankle swelling actually went away. But then around like a few weeks later, it came back again. So I said, maybe go for a scan in your abdomen. I think something is in your abdomen. And they actually found that there was a huge cyst that was accumulated around her left kidney. And that was the reason she was getting that left ankle pain. So this is just an example of how, if you understand the system, you can start to understand how connected we are. So she actually needed to operate to get that cyst out because it was growing out of control. And the doctor actually said it could be life threatening if she didn't have that addressed. But I actually see this in a lot of cases ever since I start understanding the lymphatic system. So I really want you guys to understand when we talk about drainage, there's an order of things. You have to clear this entry point first before anything else can be done in the lymphatic system more. Okay, so now I'm gonna move into the brain. So
just one more question.
Yeah, of course.
I just wanted to ask, like when you do a lymphatic massage, is there any side effects to the individual? Do you know, like when you do a massage and they rub like the neck or the muscles, you go home and you're like, ouch, this hurts or whatever, a couple of days and then you're okay. So if you do a lymphatic massage, is there any side effects?
That's a really good question because that's something that I will talk about for sure. I don't call it side effects. I call it detoxification effects, and it's very, very, very common. So basically, you're releasing toxin. It's not really releasing, you're just moving the toxin out of the area that's congested. So I actually found a lot of people after their first lymphatic work, they have what we call a detox effect. And I have a slide later on to remind myself to talk about it. I didn't realize how common this effect was. People can get a very mild fever. People can get symptoms like UTI, like very frequent urination. They can have a change of color. There's another story. After I took lymphatic drainage, I did it for all of my clients. And I did it for 6 female clients over 1 week. And 3 of them told me that they had symptoms of UTI after. And at first I was like, oh my God, I am I giving people UTI? Like, I don't understand. I didn't even connect the dot at the moment. I was like, is there like it was right before COVID. I was like, what's going on? I understand. And later on, when I asked my instructors and I delved more into the work, it's just like I'm mobilizing things that was already in your body. So I don't call it side effects. It's a good release, but it's a really good thing to keep remembering because for lymphatic work, for some people, you have to go in slowly. You can't just like open up everything and flush out everything because your body may not be able to take it. So the detox effect can be headache, fatigue, mild fever. Sometimes nothing could happen. Like sometimes there'll be nothing that will happen, but a lot of times I find after the first or second treatment, people do report having those symptoms.
Okay, thank you so much for answering my question.
No problem. And
Yeah, I have a
you're always
question
ahead of
also.
me.
I'm sorry, I always like to
No,
think
that's
ahead.
great. That's
That's
great.
me.
I encourage anyone to ask me questions along the way.
Yes,
If
I
helps
have a
me-
question.
Yes. Dee?
Yes, thank you so much. Wow, this is so much good information and just the analogies help to explain it better. I have a question. First of all, what type of doctor would you go, where would you go to get a lymphatic drainage done to you?
So there are actually different schools of people teaching lymphatic drainage. So I took 2 levels of the Botter School, manual lymphatic drainage. It's one of the oldest school for lymphatic drainage. If you want to get manual lymphatic drainage done, you can actually, I have a slide at the end of the resource. You can look up who's certified to do that specific technique called Botter's manual lymphatic drainage. So a lot of massage therapists take it. Anyone that does body work that has been trained can do it. Okay, so I took it. There are 2 massage therapists and 2 physios in our clinic that have taken the course. But on the depends on where you are. Like on the website, you can actually see who's registered. But that's
I'm in
only
the
part.
East. Yeah,
Sorry?
I'm in the East. Yeah, I'm on the East. I'm actually in Brooklyn, so that's why I
Oh,
was
I see.
asking where
Yeah,
would one go.
so yeah, you can actually look up on the list. They have all the registered manual lymphatic drainage therapists. But I have also taken other courses which don't require certification. So I want you guys to understand our body can heal on its own. Our body has its own way of clear out the lymphatic system. The manual lymphatic drainage work is very powerful. It's a great technique. But there are things you can do on your own that help the health of your lymphatic system. And I'm gonna share like some simple techniques that you can do on your own to just get the fluid moving. So that's why I want you guys to
Because I was
understand how to take care
okay.
of
I was
it.
gonna ask. I
Yeah,
was gonna ask
there
if
are a
you were
lot of
gonna.
things that you can do on your own. And there are also, like, if you look into your practitioner, they may be able to provide lymphatic work without taking the manual lymphatic drainage course. Like if you understand how the lymphatic system works, you just if you know that, okay, like you can assess where the blockage is, and I'll teach you how you can assess it yourself too. Yeah, there are a lot of practitioners that if
Okay.
they understand the lymph work, they can give you guidance on how to improve your lymphatic health. Does that answer your question?
Okay. Thank you. Yes. Thank you.
No problem. Okay, so now we're moving to the brain. So for the longest time, people didn't understand about how the brain drains itself, because it's actually like I said, the lymph vessel, you can't really see it, just fluid, right? But only in the recent years, there's a lot more research on how the brain removes toxin, because brain is an organ in our body. It produces its own waste product, right? Where is the waste going if it's not going through a lymphatic system? And they actually identify a lot of ways that the toxin can exit our brain. The main ones is it just goes through our cervical node, so the lymph nodes in our neck, the deep ones in our neck. So even just gravity can help it go down, right? We have a lot of nerves that come out of our brain. Like besides spinal cord, there are a lot of cranial nerves. So these are the cranial nerves are things that help our eye movement. How with concussion, you probably had cranial nerve assessments. They see your balance, your smell, how you move your jaw. So through each of the nerve, when it exits the skull, there's a hole, and the lymph can move out from there. The sinus, there are a few sinuses in your skull. That's also places the hole openings where the lymph can come out. In the brain, they just don't call it lymph, they call it lymphatic. It's a different name. And it merges with what we call the cerebral spinal fluid. It's the fluid in your spinal cord, and it surrounds your brain, and it can go through your spinal cord. And it's really interesting because your brain can drain through the spinal cord, and it can actually exit through the sacrum, through your tailbone. And from the tailbone, they actually have to go around into your abdomen to take the highway up. So part of the brain takes that long way down if your neck is blocked. And that is why sometimes if you have digestive issues, it can affect your brain health as well. So a lot of times when I work with people with traumatic brain injuries, besides draining their neck, their head, I do abdominal work, and I do the spinal cord, so clear it up. So if you understand that where all these exit points needs to stay open, then if you can unblock it, and it will help your brain drain a lot better. So remember this: 3 pounds of toxin every year. So if you do the math, like every day something needs to come out.
And that fluid is very important for the brain, right?
Yeah. Yeah, the fluid is important. Like, and what's inside the fluid? Like if you remember the picture I had before, you want that fluid to be clear. You don't want that fluid to be just filled with toxin.
Yeah, exactly.
Yeah, so you need circulating, right?
Yeah.
In Chinese medicine, we talk about like stagnant. Like we don't want things to stay still. You want things to move.
Move, exactly.
So the brain, how does it drain? This is something that they also found recently, is during the deep sleep stage, our brain does this movement. It actually flushes the toxin out through the ventricles and go into the cerebrospinal fluid. They call it like a dishwasher, like it goes through a cycle, and it does it in a very specific way during your deep sleep. So that's why when you don't have a good sleep, you feel that brain fog. You just feel like you're not rested, right? It's because a big part of drainage happens during your deep sleep. And the other way the brain drains itself is similar to the rest of the body through movement, like even moving your neck. When you breathe, actually the cranial bones, they move very little, but they do move. That creates a pressure change that can make the fluid move. And just gravity, like this, there are many reasons why our head is in the top of our body. This is one reason. It's an easier pathway to go down.
So that's like with osteopath, when they work on the cranial, they kind of do that movement to have that drainage, I assume.
Yeah, exactly. So like the lymphatic, manual lymphatic drainage is its own trademark name. But lymphatic work, a lot of people can provide lymphatic work if they understand the lymphatic system. So why is it important that you need drainage? Right? Drainage precedes supply. I always tell people, if you can't get waste out, you can't get nutrient in. If you have a concussion, you have a traumatic injury, you know that your brain just requires a little bit more energy in order to function, right? Like sometimes people take supplements, people get different type of therapy, but they're not getting better. It might be because it's blocked, right? You can't get all the toxin out. So you can't get toxin out, how are the nutrient gonna get back in? So it will help, the drainage can help decrease that neuroinflammation around the brain tissue, around the nervous tissue. Sometimes people get pressure headache, right? The pressure headache is not just lymph, it can be a blood pressure component. But regardless, if you have better drainage, you have more space for brain to expand and shrink through different phases of the day. Another really important point to have good drainage is it actually helps with the activation of the parasympathetic system. So it's the system that helps us relax, it helps us rest, it helps us digest, right? So if we're always in that stress state, it's really, really hard for your brain to heal. There's a really important nerve that's one of the cranial nerves in our body. It's called the vagus nerve, right? If you have inflammation around that area, around the vagus nerve, it's hard for your body to relax. So you might just always feel stressed. And when you're stressed, the tissues, they're really, really tense and the lymph don't flow really well. So you got into this vicious cycle. So sometimes those are the times you might need some extra help of movement and manual lymphatic drainage to help relax the brain. Actually, in the beginning, when I started doing lymphatic drainage from all my concussion patients, they all just fall asleep for like 5 minutes when I was doing it. And a lot of times when people have concussion, they have trouble sleeping, right? They have trouble relaxing. So I actually found this is one of the it's one of the best way I have to calm people post concussion, post traumatic injury, give them that sense of relaxation. So you can imagine if you have better drainage, it really helps reduce things like headache, fatigue, brain fog, and sleep disturbances. Okay, so now to where you guys were wondering, how can you take care of your lymphatic system, right? So we talk about it's a one-way stream, right? Like everything needs to go back to your heart. So the easiest thing, which is something that all of us can do, is take deep belly breath. When you take deep belly breath, you move your diaphragm, which is a muscle in here, right? When you make that movement, it's like a pump. So it can unlock the congestion around this areas. And it's not just the diaphragm. When you breathe, you expand your rib cage. You move your collarbone. You move the rib heads where attached to the back of your spinal column, right? You move a lot of things when you're breathing well. I think I have time. Later, I'm going to show you guys a technique to just help you guys make more room when you're breathing, right? So just taking deep breath itself can help with your lymphatic drainage. Stay hydrated is really important. So if you imagine if the lymph, if you dehydrate, the lymph becomes thicker. Thicker fluids don't move as well as fluidy fluid. Think about that old honey jar, right? Like if you tip a honey jar that's dehydrated, it's just not moving. And there are times people can be so dehydrated that just lymph just stays stagnant. Sleep, we talk about drainage of most organs actually happens during when we're sleeping, especially the brain. We can also take care of lymphatic system by stay away from toxins in the environment. So if you're already loaded with your own waste product, you don't want extra toxins from food or allergens or chemicals in the environment. This is one of the most important things. The next point is be active. Because our lymphatic system is designed to move through movement. The biggest clusters of the lymph nodes, which is the next slide, they are placed in joints where a lot of movement happens. Because we're designed that if we move those joints, we naturally will have the lymph fluid flowing. And then lastly is if your body needs more help, then you can look for someone that gets lymph work done.
And what about jumping on a trampoline?
Yeah, so that's one of the, that's one of the ways that if you're able to jump, if you're able to bounce around, it's one of the way we can shake things up. But so what I was telling you about earlier is there is an order that you need to clear the system, right? So if you bounce, but this area, this collarbone area,
it's not bouncing.
Yeah, if it's stuck and you bounce, like you're not getting this movement, you can bounce, and everything start moving, but you're stuck here. So you're just moving, like you're just shoving all the cars all the way to the Highway 7 and they still can't exit.
Gotcha.
Right?
Mm-hmm.
So
is that what they call rebounding?
Sorry?
Is that what they call rebounding?
Yeah. Like I wanted, so I'm gonna talk about this is a course I took from I don't know if you guys heard of him, Dr. Perry Nicholson. He's on Instagram. He has a company called Stop Chasing Pain. I took 3 or 4 courses with him about the lymphatic system, the glymphatic system, gut health, and vagus nerve. I actually really recommend you guys to follow him on social media because he posts a lot of great content that just give you.
Can you post this information in the chat, please?
Sure. I'm gonna copy this for you guys in the chat after. But so he designed this is called the Big 6. So the 6 clusters of where majority of your lymph nodes are. And then what he recommends is you find a spot in this order, okay, in this particular order. So you will rub, you will tap in that order to clear everything. And then he tells you to bounce up and down for 20 seconds. And I honestly, I do this every single day. I do manual lymphatics drainage for myself for my neck and head every night. And I do this every morning. And I do really find it help. It makes a difference in my overall health and overall well-being. And I try to teach a lot of people about this as well.
And you also jump on the trampoline, or you just?
I don't jump on the trampoline. Even if you do things like this, like you just bounce.
Got you.
Yeah, and when I bounce, I let my shoulder go like that.
Oh, okay.
Yeah, so it's just about movement, right? Definitely, if you have a trampoline, you feel safe on the trampoline, you can go ahead and do it. A lot of my clients that I treat, they're not able to jump. But I
am not, but I keep saying like, oh, if you have a small trampoline, I'm like, I don't think so. So there's supposed to be another way to do it.
Yeah, you don't have to. You don't have to have a trampoline to jump. You can just bounce. You can just have any way of movement. Yeah, nice. Any type of movement will happen. So
if you follow him in social media, he provides that, like you were saying, for free, actually.
Yeah. Like he posts a lot of content, and I really encourage people to go. I have to say a disclaimer. There's usually no contraindication of doing lymph work because it's a movement, right? A few, like if you're pregnant, I'll be more cautious. right? So don't bounce around. And when you're pregnant, it's not that you cannot get lymph work done, but you need to know that like a lot of your lymph trunk is actually being blocked for good reason, for growing body. So sometimes it's just you need to work with someone who really knows where how to work before doing it on your own. If you have active cancer, and like if you have cancer that like if your doctor recommends you not to get lymph work done, then I would not get lymph work done. Yeah, those
Do
are.
sorry, do we get a copy of this sent to
If
our
you want.
email? I definitely, there's a lot of great information.
Me too. I would love a copy.
Okay, if you want. Yeah, I mainly put the presentation down to guide me through what to talk about. Like I've done the presentation for physiotherapists or students where I put more scientific information. This one I didn't put any references because it's just more for general knowledge. But if you find it helpful, I'm more than happy to provide it.
It's just lots of information, but it's really good information that I could see going back to time and time again.
Oh yeah, for sure. Yeah, so I have to give that disclaimer,
Yeah.
especially with cancer, because cancer cells also, they do travel through the lymphatic system, right? Like that's how metastasis happen. So if you have an active cancer, it's just recommended that, like I do not want to be responsible for that. But Dr. Perry Nicholson, he talked about it too. It's not like if you have cancer, you don't move, right? Like every movement moves the lymphatic system. So if you're not allowed to move, you basically just getting that lymph work done on your own. It's just we don't want to be the person that says I provide lymphatic drainage for someone who's going through active cancer treatment. So for that, you need to get a doctor's clearance. And the other times you don't do lymph work is if you're sick. Like if you just get.
I have a
Yeah. Sorry, you have a question.
Yeah, I had a question. Because I try to take I usually take Tai Chi and Qigong classes, and so they do a lot of body tapping. But I was always concerned when they did the tapping under the armpits. I mean, I'm not a cancer patient, but I was still always concerned with the tapping because the armpits are so sensitive and it does have a lot of lymph nodes there. Would the tapping under the armpit cause the lymph nodes to inflame or cause a problem that would promote cancer, tapping under the armpits?
No, like that's what what Dr. Perry Nixon teaches. It's basically you tap on your lymph, your collarbone, your neck,
Yes.
under the armpit, your abdomen, your hip, and your knees, right? Tapping in, like if you have a healthy lymphatic system, or I should say, if you don't have lymph nodes removed. Yeah, for cancer patients, different. I know some of the audience, they may have in this group, they may have cancer, they may have lymph nodes removed, and you need to be a little bit more careful because if you don't have, if you have all your lymph nodes removed under your armpit, you might need a different pathway for that area to drain. But if you don't have it, I wouldn't be too concerned about tapping because it's just a form of movement. Obviously, when you're tapping, you're not going aggressively, right? You're just going with it. It's just promoting movement. And if you do find your lymph nodes swelled up afterwards, it's actually a sign that you have congestion. And you need to look into why right? Like if it is very, very common. Like I want you guys to all take a look and feel your armpit. Your armpit is supposed to be a pit. It's supposed to go inward. But I treat so many people, they don't have an armpit anymore. They just have a big swollen thing under the armpit. That's because all your lymph nodes are all swollen, they're congested. So where would I treat? I treat their collarbone, I treat their neck. Because or I treat their chest because I can sense that there's something under here that's not being drained. Yeah, so I wouldn't be concerned. Like Tai Chi is great for you. The tapping is great. If you want to adding the tapping, you can kind of do it in the order that I posed here. Like remember, you understand everything had to go through collarbone. So you just rub and tap, rub and tap, rub and tap, and just do it in that order. But this presentation, I'm not technically teaching everyone how to do things, because I make things individualized. I just want to give you guys an example of what self-lymphatic work would look like.
What
How do you
about
feel about the
brushing?
gua sha?
It's a good question. It's another way to move the lymph.
Okay, that I was wondering.
Yeah. So some people respond really well to gua sha, some people not so much, because gua sha does cause skin to bleed, right? So if your lymphatic system is not moving the best, like you would notice some people, the gua sha, the sha stays there for like days. Some people
Right.
it also clears right away. So
Mhm.
it's just one of the things you have to see what the body type is. Some people,
Okay.
the skin is really frail, then I wouldn't do gua sha. I wouldn't want them to bleed.
Okay.
Yeah,
Thank you.
no problem.